Ageism is where you discriminate against an individual on the basis of their age. This happens at two levels. You can have ageism against younger people and ageism against older people, or ageism even against middle-aged people. But what is most common is where discrimination happens against older people because of their age. They're not seen to have been, they've lived their life, they are no longer valued in society, they've got nothing to offer, they're a problem to society, they shouldn't have a voice. They should basically be seen and not be heard. So that is very common. Amongst younger people, it plays out, especially in the job front, where you advertise for a job, a young person comes, they have the qualifications, they may not have the experience, but they have the knowledge to be able to gain this experience, but to dismiss them basically because of their age. We see a lot of ageism against older people.
How does ageism affect the mental health and well-being of older individuals in African communities?
Where ageism exists, then that means that there's discrimination. Then discrimination almost always is almost always followed by a violation. So this happens like if you're discriminated against because you're old. Let's take the case of COVID. When COVID-19 hit and the vaccines were rolled out in Africa, it was not always very easy to get them. So the queues were very long. And we knew that COVID affected older people. They are more predisposed to COVID. But what would happen in many, many cases in Africa, in the studies that we did, you'd find that when older people would go for the vaccines, number one, the queues would be very, very long. There'd be no attention paid to the fact that these older people cannot queue for that long. When the vaccinations would start, you'd hear health workers saying, we want to save the younger people, since in any event, you older people are dying, you don't need the vaccine. Of course, that affects you as a person, that affects your mental health. And it also doesn't make sense, because if it's the older people who are predisposed to the virus, then why not protect them first? Why not make arrangements to make sure that they get vaccinated first? So of course, that had a very serious effect on older people. When you go to a doctor and you're pushed aside, it affects your mental health, but it also affects the mental health of your caregivers, your children, or the people who take you to hospital, because then you don't get the treatment you deserve. They don't know whether you're going to survive or not. That affects your mental health and their mental health. And then, of course, cases of isolation that come about.
So what specific strategies does HelpAge employ to combat ageism and promote the rights of older people?
At HelpAge, we work on four main issues. We work on income security, we work on healthy aging, inclusive humanitarian action, and we work towards a society for all ages. So to do that, then one, we prioritize the issues of older people. We make sure that we have the rights, the voice, the agency is taken care of, so that then we're taking care of issues of discrimination, taking care of the issues of their well-being and their dignity.
And finally, what is your message?
The first one is that older people are human beings who have rights like everybody else. When the Universal Declaration on Human Rights was passed, it was not passed for any age group, it was passed for every human being in the world. Number two is we have a slogan that says, older people are older and they're not over. That means that they have a voice, they have something to contribute to society, and their lived experiences should not be ignored. Our third message is that even though we look at a future mainly from a young lens, these young people will grow older. So we want to use the lived experiences of older people to inform the experiences of the younger people. So intergenerational solidarity is extremely important. We want those addressed so that when the younger people step into older ages, they step into an older age where the rights, their well-being, and their dignity is upheld.